Nasal polyps treatment. Nasal polyps should not be left untreated as they keep growing and cause serious problems and embarrassment. Conventional nasal polyps treatment is via two routes, steroid therapy or surgical removal. In most cases, the first line of treatment is a steroid course which may involve steroid sprays, steroid tablets, or a combination of the two. Steroids can shrink down the polyps in about a week. However, the shrinkage will be sustained only as long as the steroids are used. Once the steroids are stopped, the polyps will start growing again and often to a larger size than they were before. Unfortunately, steroids can only be used for the short term as they cause side effects such as headaches, nosebleeds, sore throats, vision loss, and increase the risk of glaucoma and cataract formation. In children, steroids can cause stunted growth. Weight gain also often occurs with steroid tablets. If you haven't started, this will save you from getting stuck in a vicious cycle where you have to rely on steroids to keep your polyps down. The other conventional cure for nasal polyps is surgical removal, and this can be done in two ways. Polypectomy is removal of the polyps by getting at them through the nostrils. It's the most common type of nasal polyp surgery, and apart from polyps, some bone will be removed in an attempt to reduce the rate of regrowth. The other type is endoscopic sinus surgery, and this procedure will be used for large polyps or where there are clusters of them. In this procedure, a cut is made in the face and the polyps are removed by entering through these cuts. Unfortunately, even surgery is not a permanent cure for nasal polyps, with a staggering 75% of the patients undergoing surgery experiencing a nasal polyps regrowth within a few weeks after the procedure. This is because the underlying cause of the polyps will not have been tackled, and the nasal passage will quickly become inflamed again, resulting in a new polyps regrowth. In light of this, one wonders why anyone would opt for it, as it is expensive. Nasal polyp surgery costs anywhere between $3,000 to over $30,000 and carries many risks such as eye damage and the possibility of causing growth of scar tissue. If the polyps are very high up the nose, there is a possibility of brain fluid leakage during the procedure. A much better, safer, permanent approach to getting rid of nasal polyps forever is by following a protocol called the Nasal Polyps Treatment Miracle. This approach amalgamates modern nutritional and medical principles with Oriental medicine and guides you step by step on exactly what you have to do to get rid of nasal polyps permanently. You can get Nasal Polyps Treatment Miracle on the link below this video.